everyone. Welcome to CareCast. For our second episode, we have Dr. Bastian, a neurologist. We're here today to discuss the brain, mindset, dreams, and how stress affects our brain and many more subjects. And without further ado, let's get started. So, hello, doctor. How are you?
Alhamdulillah, nice meeting you.
Thank you for accepting our request to join CareCast. On today's episode, this is our second episode, and our guest is a neurologist. May you please start by introducing yourself?
My name is Dr. Bastian. My full name is Dr. Bastiaan Ter Meulen. It's a Dutch name, so I am originally from the Netherlands. I was born and raised there. I studied medicine in the Netherlands, Belgium, and the US. And I worked for 15 years as a consultant in neurology in the Netherlands, in Amsterdam, in a major hospital. And then I decided to move to Jeddah in Saudi Arabia, where we are right now. And the reason is mainly twofold. One is work for King's College Hospital, which is really like a well-known name in medicine. That's one. And two, the city of Jeddah has a lot of opportunities to develop like professionally and personally. So I'm here since a couple of months now and having a good time. It's a new hospital, so everything has to be built up from scratch, so to say. But Alhamdulillah, we manage.
It's very nice. So let's move on to our first question. Medicine is known for its lengthy and difficult path. How many years did you study and how was your journey during that time?
Um, After my high school, so when I was 18, I went to university first in Belgium, in Leuven, which is near Brussels, and then to Nijmegen, which is in the Netherlands on the border close to Germany. So I studied medicine for 6 years, and the last 1 year I went to America as part of those 6 years. So I lived in New York City, went to Mount Sinai Hospital, and I lived in Chicago at Northwestern University. And after those 6 years, I wanted to do neurology, my current specialty, because the brain is, for me, the most fascinating organ there is. If you have like a brain disease, it will affect your whole being, everything that you have and who you are. So, brain diseases are very puzzling and very fascinating, and so are patients with a brain disease. So, that's the reason I wanted to do neurology. And I did my residency in the Erasmus Medical Center in Rotterdam, the Netherlands, which is like a major hospital in Europe. The last 2 years I did it in The Hague. So totally it was a trajectory of 6 years of studies in medicine and 6 years for specialization. So making up for 12 years. And of course, in those 12 years, there are delays, there are waiting times. So eventually I was 32 when I became a neurologist. So in total, like 14 years that it took me.
Humans experience difficult times as well as joyful times in the career path. What do you think is the best and worst part of your job?
Um, the best thing are the daily encounters that you have with the patients and the patients telling you stories. That's really like the spice of this job. So it's really important to have like the personal encounter with your patients and not that it's just like a back or hernia you are mending or like a heart problem that you are mending. No, it's a person that you're healing, right? That you are dealing with, that you are trying to heal. So I think that's the most beautiful about this work, like that it is about people, and also there's the interest in the brain and in neuroscience that makes it very interesting. And the bad things about the job is that sometimes you lose patients, right? And we cannot cure anybody. And the stories that make that were most impressive over the years were like especially the younger people that dies. For example, hematoma of the brain or a coma. So that's horrible. And Normally, I do not take the work to home, but those situations they last, and you think about it, and you talk about it with your colleagues. It makes you reflect. So yeah, those are the bad things, and also bad things. You can consider a bad thing that as you are young and a student or a resident that you make very long hours and that it's all on medicine and there's not that much social life besides. But that's something that will be overcome. I mean, that's like a couple of years, and after that, you go into a new stage as a registrar or as a consultant, and then life will get slowly will get easier on you.
Um, if someone is listening, if someone listening is thinking about becoming a neurologist, what advice would you give them? What's something you wish you had known when you just started?
Um, that's a good question, but also like a difficult question. Yeah, thank you. Thank you. Well, the thing is that when you start your studies, you learn a lot from the books, but the real learning happens in daily practice. So the hours that you work, but mostly during the studies, at least in the Netherlands where I studied, it was very focused on medicine, but not so much on all other aspects of the job. So, for example, legal aspects, ethical aspects, financial aspects, like everything around this job, so to say. That is also very important. How a hospital works. For example, a hospital like this, people come here. How does it work with the insurances? Who pays the bills? Is there anything like are there private investors? Is there like the government involved? Like all those like more things, aspects from society, you do not learn it as a student. And I think that it would be useful to learn more about how like a hospital works, or how a society works, like a Ministry of Health. What is their role? What can they do? And yeah.
I'm sure you have seen a lot of cases that were difficult to deal with. What was the most challenging surgery you have performed?
Well, first, I'm not a surgeon, so a neurologist is a doctor that treats brain diseases. But we do the diagnostic procedures, and we treat everything conservatively, that is, with medication or injections. So we do not do surgery. That's the neurosurgery. And your question was like the most impressive case.
Yeah, or difficult case.
Yeah, the most interesting or difficult cases, I tried to publish them because I wanted to learn, that people could learn from them. And one of it, I don't know if you can I can show it to you with on the camera. Is this case? I can show it to you because it was published. It was a case on a man that suffered like a major injury with the motorcycle. He fell with his motorbike, and then the nerves here in the neck he got cut. So he did not feel or could not move his arm anymore. And after like several weeks, he sensed like as if there were like a third arm. That's like a hallucination or a phantom sensation he had. So he imagined that he had like an arm laying aside his own arm.
So he imagined like two arms.
Yeah, yeah. So three in total, right? So he had a phantom sensation. That's what you call it. It's phantom, and phantom sensation and phantom pain is very, very painful. So what we did is that we tricked his brain by using a mirror. Let's see if I can. I'm trying if to we can open it. There you go. See, so here we are. Here he is sitting. So this is the left arm that is paralyzed, and he feels like as if here is like the third arm. At, laying aside, and now we have put the mirror between his legs. See, this is the paralyzed arm, right? But if you look from this side, from the other side, and we will turn the camera again, then you have the mirror here, and it seems that he has like a normal left arm, that it's moving normally. So this is the way to treat his phantom pain, and yeah, he cured. So the pain really vanished this way. So this is like mirror feedback therapy. That's what you call it. So this was quite a story. So when we were able to get it into like neurology, it's like the magazine for neurologists worldwide. So we were happy to have it published there. So most cases I've been treating over the last years were cases that had to do with pain. So severe headache, like migraine, or the other one is cluster headache. So to treat that in an efficient way, or these kind of pains and phantom pain. So that was my focus over the years. And I've also seen a lot of patients with what you call Alice in Wonderland syndrome. I don't know if you've heard of that. So do you know the book by Lewis Carroll or the movie? So it's about like a girl that has everything becomes like bigger and smaller, and you have all these changes in perception. And actually, the author of that book, uh, Lewis Carroll, who was from England, he suffered from it himself. So he was a patient with migraine, and during migraine, sometimes people have these experiences that the wall comes to them or that the ceiling starts wrinkling. You call that like metamorphopsias or perceptual disorder. And nowadays we know it as Alice in Wonderland syndrome. So it's a very interesting disorder on the border between neurology and psychiatry. So, and I've seen like 20 or 25 patients with that, and together with a psychiatrist, that was very interesting. Yeah. So, pain patients, patients with Alice in Wonderland syndrome. Yeah, in neurology, there are many interesting patients. Yeah.
It's pretty amazing how our brain and nervous system work together to control everything we do, from simple movements to complex thoughts. When you think about it from a neurological perspective, what's really happening in our body?
Well, I think that the brain is in the body, so that our bodies are what we call embodied minds. So the interesting thing about the human body is that it's both like an object and a subject. So to say, if I touch my hand, this hand, so this hand touches, but it's also my own body that is touched, right? So it's very interesting how the nervous system and the body like interact. So I think that your mind is in your body, and we have many examples of that. For example, if you have like stress for an exam, you feel it in your body, right? You feel it in your stomach. Or if your work is very burdensome and if you're very stressed, you can have like a headache. So I think that the nervous system is really all over in the body. So it cannot really be separated. So maybe you can distinguish the two, but they are really the same.
So, Alzheimer's and dementia are conditions that so many people worry about. From your perspective, what are some symptoms that people should look for?
Alzheimer's disease will start with forgetfulness. So especially problems of the working memory or the online memory, so things that have shortly happened. So for example, that I cannot remember anymore the question that you just asked to me, and that I'm losing it, and I'm repeating myself, and I'm telling the same story several times. So Alzheimer's disease will primarily affect like the working memory or the short-term memory. The thing is that memory problems can happen at all ages. So not all memory problems are Alzheimer's disease. For example, if you had like a very bad sleep, or if you have very busy working day, or day at school, uh, it's hard to remember everything that happens. So your memory has limitations. So many people have memory problems, but that does not mean that they are demented, right? So memory problems and dementia is not really the same. No, Alzheimer's disease will start with memory problems and then it will gradually become more. So also problems with recognition, like not being able to recognize faces of the ones that you know, your family members, or losing the way in the street, not knowing the way home anymore. So over the years, the disease will become worse and worse, and the impairments will become worse and worse. But it will start with the memory, and from there, it will gradually become more. And from the anatomy of the brain, it will start in what we call the hippocampus, which is an area of the brain which is very deep. It's like exactly here, but then down inward. It's what we call the hippocampus. It's so called because it has like the figure of like a little horse. Hippocampus means seahorse in Latin. So that's how it looks, and that's where it starts. So it starts in the areas of the brain that are responsible that we need for our memories, our short-term memories. And from there on, it passes to what we call the cortex, the rest of the brain. Yeah. And Alzheimer is really becoming more and more. So the number of Alzheimer patients will increase. And what we need is more awareness, how to recognize, but also more understanding. And it should be no taboo, right? It should be, we should talk openly about it.
Um, I just want to ask if Alzheimer, like, does it first start when you're young or when you grow up when you're older?
It's normally like the disease of the older age, so that means older than 60, 70. It can happen at a very young age. Those patients exist, and usually there is like a genetic deficit. So they have like a deficit in their a mutation in their genome, which makes them more susceptible to it. But normally, it's a disease of the older age.
You spend so much time studying the brain. What's one thing about it that still amazes you, even after all your experience?
Especially the what we call the plasticity of the brain, so the capacity to regenerate. So you have your nerve cells, you have billions, right? You have a lot, but nerve cells they don't replicate. So, for example, if I have like a cut, right, there will be just growth, right? The skin tissue and everything will just regenerate, will grow. But brain tissue, the nervous cells, you have one pool of nervous cells, and that's it. So they will not divide themselves into new cells. However, they have like a really fascinating capacity, and that is to make like new connections with other cells. And that's what we call neuroplasticity. So whenever there's any brain damage because of a stroke, the healthy brain cells will start doing their work and make like new connections in your brain. So that's what you call neuroplasticity, and that's really, really fascinating. So sometimes a person with a stroke who has like a bleeding or an infarction cannot move his or her arm, is totally paralyzed. But then the brain starts working. So the healthy cells, they will take over. They will make new connections, and that will make like the limb slowly work again. And this capacity of the brain, you call it plasticity or regeneration, is really fascinating.
There's an old saying that we only use 10% of our brains. Is there any truth to that, or is that just a myth?
Well, you have many processes in the brain that we are not aware of. So I think that it's not to do with we only use 10%, but maybe it's the 10% that we are conscious or aware of. So many things in the brain happen without me being conscious of it. So, for example, your breath, or your heart rate, or your temperature, all those functions, you do not think about it, right? Would not be good that you have to say, well, today it's like a hot day outside, so I have to pull my temperature a little bit down. So you cannot do that. The body does it by itself. So your brain really has like many capacities that you're not even aware of. And sometimes you see or you hear things not even consciously, and your brain is already reacting. Like for example, when you are in a room with people, the brain has already noticed things that you're not even aware of. So to get back to the question, I think it has to do with awareness or consciousness. So we are only partly conscious, and under that consciousness, there's like a huge amount of processes. So you can compare it to like an iceberg, right? So if I have a picture of like an iceberg, you might know that. You see here, here's the iceberg. So where's the most of the iceberg?
Down the ocean.
Under the water, right? So and that's the same with our brain. So this is what you said, the 10% that we are aware of consciousness. And this is like our subconsciousness or unconsciousness, that where all the processes in the brain and in the body that we're not aware of.
I have read about how the brain doesn't feel any pain. That means surgeons can perform brain surgeries while the patient is wide awake. Is this true? And how?
This is absolutely true. Yeah. So you have the nerves that feel pain at the outside of your brain, so beneath the skull, but the brain itself is completely pain free. And sometimes what happens in a hospital is like an awake craniotomy or awake operation. So what they do if a patient has a brain tumor, they want to cut the brain tumor out, but if the brain tumor is at the left in the language areas of the brain, you really want the patients to be conscious, to be aware during the operation, and you give him tasks. You tell him, you ask him things to say during the operation. So the surgeon is cutting the tumor out, and in the meanwhile, the patient is talking, and that's what we call an awake craniotomy. So it's an awake operation, and we do that to know that we spare specific areas for, especially for language, yeah, during surgery. So it's true.
So, we all know that stress isn't great for us, but how does it actually affect the brain? And can chronic stress contribute to neurological conditions? What can we do to prevent that?
Well, stress means that there is like the body is in a state of continuous arousal, and the hormone responsible is cortisol, and if you have like high levels of cortisol, that really has an effect on many structures in the brain. For example, the memory, right? So I just told you about the hippocampus structure for the memory, and if there are high levels of cortisol, the function will become less. So you will have problems with your memory. Also, chronic stress will have effects like on the blood vessels. So you will be more prone to arteriosclerosis, so narrowing of the blood vessels. So yeah, um, stress has many effects. It will affect your sleep. Sleep is of course really necessary to have a healthy functioning brain. Um, so stress is no good for many reasons. And yes, we should do like prevention of stress. Yeah.
Speaking of sleep, I have some questions about
Yeah,
dreams.
sure.
I personally feel like dreams and sleeping in general are surreal because it's almost like the person is dead, but their mind is awake.
Yeah.
All of their organs are awake.
Yeah.
Um, so what really makes us dream what we dream? Like, how do we dream those scenarios in our head?
Yeah. That's something that we really don't know how that works. So it seems that in the sleep, that the sleep has different stages. So the deeper the stage, the slower the brain activity is. So you start at stage 1, very light sleep, you go to stage 4, deep sleep. And if you do like an electrical recording of the brain, an EEG, in the deep sleep, stage 4, you will see very slow brain activity, slow brain wave. And then all of a sudden you got your rapid eye movement sleep, your REM sleep. So you go from stage 1 down to 4, and then you have the rapid eye movements. So during the REM sleep, the eyes are moving, and it seems that that triggers like visual processing in our brain. So at that moment, the brain will start seeing things. So it's for that is one of the ways that it works with dreaming, and all kind of subconscious things come up in dreams. So I just showed you the iceberg with the top and everything down it. So what dreaming does is that it makes you go down into the iceberg to see what's under the water, like emotions that you have or memories that you have. It may all come up in dreams. And of course, there are many like books and stories on dream explanation, um, but that's not really science, right? We don't know if you see like a cat in your dream that has a certain meaning or something. No, you cannot say that.
Um, so lucid dreams are dreams when people realize they're in a dream and they can control it, right?
So yeah, you mean that the people realize that they're oh,
In the dream and they can control the dream. Is that correct?
no, I don't think so. No,
So
no.
what are lucid dreams?
Lucid dreams. That's at the stage between so between sleep and waking up, you have like a phase in between, and those are the lucid dreams that you're partly awake but also partly sleeping. So that's fascinating because that's really like when it's goes the one goes into the other, like the dream and the reality they can go together, and that's usually like in the early morning that you have put your alarm and you have to wake up because you got to go to school, but then you think, wow, I can sleep a little bit more, and then this will start. Yeah, so it's usually in the early morning.
Um, let's talk about screen time. In this day and age, kids and teenagers get scolded for spending more time on their phones or iPads or laptops. Does screen time really affect our brain and how?
Well, we do not really know because what the effect of all the screen time on young people is, and also not on all the elderly people. So we really don't know. So you can say that our brain is wired for the connectivity with other people, like in real life, right? So, but if there's always like a telephone screen, so people come together and they meet and they're all on their phones, and there's no interaction. Um, yeah, I think that's really like a problem in terms of like development. And also, screen time can be very addictive because every time you get a like or you get a thumb up, right, you want to have more, right? So that's really, I think that social media can be very addictive, and of course, addiction is no good.
We all want to keep our brains healthy as we get older. Are there any simple, everyday habits that can really make a difference in maintaining brain health over time?
Yes, to be active, to do sports, to be among people, to have like social encounters. So if you isolate yourself, your brain capacity will become less. And of course, to do mind games, right? To solve like puzzles, things like that. Yeah,
I want to ask, how does social interaction affect your brain?
I think it's social interaction is really it's really necessary for us to function. We know that people that are lonely, so that lack social interference, that they will die at an early age, that they are depressed. So that shows that we really have a need for each other and each other's presence. Yeah.
Um, this is going to be the last question.
Yes.
I don't know if it's like related to your major, but it's talk about mindset.
Yeah.
How can someone change their brain and mindset to have a better lifestyle?
Yeah, that's not really. That's more like a question for like a psychologist. But let me give it a try. Well, your mindset, of course, is everything, right? So if you go like to this hospital and you're really not having like you're not really willing to go to work or willing to see the patients, it's going to be a very long day, right?
Mm-hmm.
And also to school. If you're not having fun in school or you're not like it will be a long day. On the other hand, if you are if you like it, if you're having a good time, for example, here at the job, or if you in school, if you really like it, the day will pass easily and time will fly, as they say. So I think the mindset with in the encounter with the other person or the task you have to do is everything. And also, if you have like an appointment with your friend and you think, well, I really I don't like her and I don't want to be with her, then it will be you will not have a good night. Whereas you think, well, we're going to make fun, right? We will go out and we will go have dinner. Then I mean, it makes a difference. Yeah, but that this is more like folk psychology, right? This is more how people describe this. This is not like a scientific explanation.
Yeah.
Yeah.
Thank you so much for joining us today.
You're welcome, and good luck with your school and study. Yeah.
Thank you.
Welcome.
Had so much fun.
Yeah. Wonderful.